Now, the government has set a maximum monthly limit for vaccine stock in private hospitals. The new rules will come into effect from tomorrow, and the centre has revised the formula to decide the maximum monthly limit of stocks that a private vaccination centre can purchase to ensure a level playing field. Let's go across to Sukirti for more. Sukirti, give us more details of this. And this is something states were also asking, that they wanted more stocks to come to them rather than go to private hands.
Well, yes, recently Tamil Nadu and Odisha, their chief ministers or health ministers had written to the Union Health Ministry that private vaccination centres were procuring a lot of doses but not vaccinating enough people, and these states had demanded that the ratio of government versus private should be changed from 75-25 to at least 90:10. So the government should have greater control. While the government has not changed that procurement policy, 25% can still be taken away by private vaccination centres. There are still these very important changes that have now been made to the procurement policy. One, private vaccination centres, these private hospitals will have to now route it through CoWIN instead of directly procuring it from manufacturers. So they will have to apply for the procurement on CoWIN. That will be sent to the manufacturers. Now, the government says that we will not approve in terms of, there's no mandatory approval that is needed from the government for these private hospitals, because these submissions will then be sent to the manufacturers. But there is a certain criteria that needs to be fulfilled. There is going to be now a monthly limit. Only a certain amount of doses can be procured by a private hospital within a month, which is going to be the double of the average daily consumption for a particular week that will be selected by these private hospitals. So limits to the monthly consumption, monthly procurement that these private hospitals can take, and also now they will have to route it through CoWIN instead of directly taking it from manufacturers. So these are big developments that have come possibly in the light of these demands that were by the states for greater government control.